Теперь пас. Молодцы. Готово? Hello, dear colleagues. My name is Mynzhylky Berdikhojayev. Together with my assistant, Rowan Maratullah, we are from Presidential National Hospital in Almaty City, Kazakhstan country. Fen? Operating nurse is Vakht. The second nurse is Akhl. And anesthesiology team is Жанна, anesthesiology nurse. Soli is anesthesiology nurse, and anesthesiologist is Solim is anesthesiologist, and Жанна is anesthesiology nurse. And video support today presented by Videon company. Evgeny is hard working for last couple of weeks. That's why Roman Povyshev is helping us to live stream, and thanks to Videon company and the team of Evgeny, and thanks to Roman, this video streaming is possible. The name of the hospital is National Hospital of the Medical Center of the Presidential Affairs Administration of the Republic of Kazakhstan. Yes, it's a presidential national hospital, Almaty City, Kazakhstan country. And patient number 3, yes, the second patient now in the operating room. My colleagues Abzal Jumabekov and Marat Sarshayev, together with Davlet Suyumbetov, started the AVM, the epidural, subdural hematoma evacuation with the cisternostomy, with the laminectomy and the posterior fossa decompression. It will take time. It will take time, and unfortunately, yes, it's a part of practical life. Tagbar system. We took a Fubuki 7 French angled. Так, Балтовский беру керек. Мынаны бересің. Нен, Eclipse аш бересаш? Eclipse. И бір трехходовой крайник керек. Yes, the guiding catheter is Fubuki 7 French. We placed through the 8 French short sheaths, and we took Vasco 18 plus with the castrato. Vasco 18 plus with the hybrid 12-14. Vasco will hybrid 12-14 from the balloon we will use for the navigation. Трехходовой краник керек. Ага. И ана үшінші системаны жалғайсаңыз. Yes, I will prepare the balloon, but will not place it inside. It will be used for the navigation mostly. I hope it would be no force majeure situation. Yeah. Yes. The problem was I'm a little bit tired, and it's a human factor. That's why we had that complication, I think. It might be the human factor. We couldn't exclude the human factor. That's why I need to be more concentrated for this case, to prevent the stupid things and to prevent the complication. Okay, first of all, we will. This is a unruptured, unruptured dual MCA aneurysm. The first on the early temporal branch and the second is on the temporal branch. Little bit later I will show you. First of all, I will prepare my micro devices, and now Rowan Aiteli, the father's name is Marat. Rowan Maratlı Aiteli, yes. He's very talented and with a very nice potential, and he's not married, that's why with the greatest potential in the department. The Sheikh Ahmed is going to be married in next 10 days, and then he will lose the potential for the young ladies, and only the Rowan will be perspective. Okay, it's a joke, it's a Kazakhstani joke. Maybe in some part of the world it would be not okay, but in Kazakhstan we can joke like this. It's okay, it's a cultural things. When I will be in Europe, I could not joke like this, but in my country it's possible. Yes, I'm a little bit tired, and I need a second connector. We had the FreePass 14 microcatheters through the FreePass 14, which is 17 microcatheter. It's like a gamma microcatheter, but a little bit stiffer than gamma. We will use LVCO. I think in this case 3.5 by 35 will be better, because this anatomy, this one is look like more than nearly 3 millimeter, and the Achero is 2.5 millimeter. That's why better to use 3.5 by 22. Или 2,5 жеріміз ба? With 2.5 by 22 it would be better. 2,5 жақсы болады, 3,5 үлкенде болады. With the 3.5 we can little bit prolapse inside the aneurysm, and it prevent to occlude the branch. We can place several coils and compress with the stent. That's the idea. I hope it would be better. Okay, let's see. Let's see what we can do. Спираль. Бірінші спираль ашып бересіңізші. Так, 386. 3/6 болады. 3/6. Ана екіншісі кішкентай екен. Okay. The lessons learned from the previous case. The tip of the guiding catheter should be in the visual field. Yes, I have different assistants, that's why from case to case it might be a little bit confusing. Okay, вперед, стоп, The branches are temporal, the both one, and if you don't want to go to the territory, then instrument is all the time to going to the territory you don't want to go. Yes, there is no branch, but it's going. Okay. This is a branch to be stented. think we can leave it here. It's the first step. Yes, through the free pass 17 we can place. Жана free pass'ın коробкасын көрсөтчүш. Коробкасын көрсөтчүш. Yes, to be sure that free pass is 17. Yes, it's 17. Rahman. Bolt. That's a 10 system catheter. Thanks to our partners, they give us the catheters to do our regular job. The tender is on the way, and we should work with the available instruments. It's like the end of the year, but it's not the end of the year. No? Okay. And for the coiling, we should use 1821 microcatheter, which is Vasco 18. That's why which could be a little bit stiffer than the regular instruments. Okay. Now we should go to the distal aneurysm. Okay. Start. Sure, start. Okay, before the stent is coming, upstairs, sure. Yes, this is the anatomy. The branch is coming from the aneurysm, this one. It's going to the temporal lobe. Spiral ашпасаңыз ғой, yes, and the second branch is also the temporal one. Yes, maybe in this case better to place a flow diverter stent and forgot about it. But it's not available. Кастратор. Жаңағындай екіне сала салу керек, не? Ал біз оның ачайын тағы салу керек. Басқа да. Мақсат берешті, бір жылатып алып. Шын етерер. Дәл операцияның үстінде келіп жылайтынын айтсайшы. Таза чемкенскийлардың түрлігі. Может быть. We are just joking. Yes. It's a we are talking about Texas, Kazakhstan, Texas. Texas, yes. The Chimkent is local Texas. Texas туралы айтады. Okay. Now we have two aneurysms on the MCA, the irregular shape, that's why it's indication for the treatment. Yes, for some reason it could be the indication for the clipping, but patient asked for the endovascular treatment. Fetal PCOM, no P1, maybe hypoplastic one, but it's okay. Vertebrobasilar system is okay. This is MCA territory. Again, MCA territory. This is a regular shape. It might rupture. That's 3D. The left carotid looks normal. But with the 2 aneurysm, the probability of developing the third aneurysm is 10%. That's why patient should be correctly and precisely followed. Yes. No more aneurysm on the left carotid territory. Vertebral artery is hypoplastic on this side. That's okay. And then we started coiling in this projection. This is a little bit not correct projection, but then we can see the branch. We can see the branch. Okay. Yes, we have 2 markers for the vascular. That's good. Yes, as usual, the tip of the coil is smaller. It was designed specially to prevent the rupture, but it's not so comfortable because the coil is all the time trying to migrate. And from my point of view, it's not so. Yes, no stent is coming. Yes, it's better to control from distal to proximal. Yes, we can start from this bifurcation. It is a bifurcation. The length of the stent is quite long. That's why I prefer to start a little bit distal. Okay, let's open a little bit. Okay, now I think it's better. Okay. Let's see it a little bit closer. Might be like this, yeah? Like this is better. Okay. Bir ikide altı per veriyorsanız. Kaz bir sekund. Akili verin bakın. Yes, the branch is still there, that's why we can detach. Ikide 4 болса болады. Отделять беріңіз. Yes, as you noticed, today we started with the detachment system of the whip. And coil is detached. Екі жарым үлкен болады. 2/6 или 1/4. Ішіне бір спираль салса жетеді, өйткені алвис ғой. Нормально болу керек. Нормально болу керек. Береміз. Yes, there is no 2/6, that's why we'll use 1.5/4. Just a second. Optima var mı? Optima 2'de 4 aşk verirseniz Optima. Aşağı gidiyoruz. We'll place Optima the second coil. Bir canım soslu salırız. Бәсе, екінші операция сүре қоспадыңдар да? Right. Surprisingly, for the last 3 weeks, we are working with the 21 microcatheter to coil the aneurysm. It's very strange situation. Okay, the second coil is Optima 2x4 complex one. Complex 10 system coil 2x4. I think 2 coils is enough. Jet coils. Right. Optima. It's a prophylaxis of Alzheimer's disease. Alzheimer's disease. If you work with the different kind of things. Она екінші aneurysm отырамыз. I think it's enough. I don't need. Yes, it's enough. Let's go with the microcatheter for the smart mask. Stop. Smart mask. Okay, no problem. Right. Yes, it's under the stent, that's why it should be okay. The coil loop is stable. I think we detached the coil. Сперва результативно. This coil was detached. It was fixed by the stent and then алдыға қарай тер. It's not detached, but it's not. It's stretched. Сетник көт. Так. Бақыт 1,5 бере салшы. 1,5. Optima болса дұрыс болады.
Optima ма?
1,5-4. 1,5-2. 1,5-3? Я 1,5 бере салшы.
1,5 бере салшы сол.
Okay, let's go. Что еще? Самое это сказать, видно, спираль слова вырос, он еще спираль. Назад. Вперед. Стоп. Угу. Стоп, мозг. Yes, now we're using hybrid 1214, which is quite soft device. Спираль вырезал. Опа. Отжатый именно. Миру. Все вроде. Yes, the catheter is facing the dome of the aneurysm, that's why we need to take back a little bit. And at this point we should open the stent and continue to open the coil. Отдели. Yes, both aneurysms are now coiled. And, the stent and coils will do the rest of the job. That's why we can detach the stent exactly at the MCA territory. Okay. Now it's 11 minutes from the opening the first part of the stent. We can wait for another 10 minutes. The distal aneurysm is occluded, the proximal is also occluded. The rest will be occluded by the time and the braided technology. And only problem with the upper branch, but I think it would be no problem. Okay, so let's wait for another 9 minutes. We'll do control angio. Now we will do the expert CT. Okay? Okay, let's wait. I hope it's the last case for today. Let's wait for the control and then we can discuss. Okay, dear colleagues, expert CT is ready. The stent is in place. Both aneurysms are coiled. Now we can see the coronal view. Yes, everything in place. We'll wait for another 6 minutes till the last control, and let's do quick review. The vertebrobasilar system and brachycephalic trunk. We can see the both aneurysms here. The vertebral territory looks normal. P1 is hypoplastic and fetal type of PCOM is present on the right side. One aneurysm and another. This aneurysm is a regular shape and the first aneurysm is micro. That's why we decided to occlude both aneurysms. We did a 3D rotational and then Rowan made control angio for the right hemisphere. Everything is clear, no problem. With the 45 degree, everything is clear. Left vertebral is hypoplastic, but it's present. And then we take hybrid 1214 from Eclipse balloon and then place the free pass catheter distally. And through free pass we partially open the Elvis Evo 3.5 by 22 and start coiling. We place 2 coils in the distal aneurysm and then renavigated the Vasco 18 plus, which is Vasco 21, inside the proximal aneurysm and placed another coils inside the proximal aneurysm, and finally detach the stent. I hope the hopefully there would be no problem and we can finish the case without any excess. Yes, this branch is jailed, but I hope it will be okay, this territory. Upper collar territory. Control X-ray was okay, and now we will wait for another 3 minutes. Okay, let's wait. I will be in the room. Okay, let's wait. Okay, dear colleagues, now, abscess. now the control angio is ready. Okay, let's analyze together. The catheter was here. It's just 2.5, maybe 3 centimeters from the orifice. Let's measure. Usually it's enough. It's 2 centimeters. And now, okay, let's see the aneurysm first. This aneurysm is already occluded. Maybe some part at the neck, but it would be healed by the stent. Nice stagnation. We administered 3000 units of heparin. This branch is clear. This aneurysm is also started occluding. With the braided technology, usually it's a matter of time, but aneurysm will be occluded. And the temporal territory is fed by the branches with no problem. Let's compare with the images before. This was before. This was before. And this was before. Let's see this one. And then let's see, I think it's the last one. Yes. Okay, let's count. 1, 1. Bifurcation 2, 3, 2, 3. This one 4, 4. This one 6, 6. This one 7, 7. Yes, everything is in place. Aneurysms are occluded. Stent is patent. Now the stent is exactly in the MCA territory, in the frontal branch, and now we can finish the case. For today it was planned 3 cases. We already done all 3. The patient number 2 in the operating room, and the plan is to do posterior fossa decompression with the C1 laminectomy, C3, C4, C5 laminectomy with the clear the anterior part of the spine, medulla, and I hope patient will recover. And the bleeding at the last angio was stopped by the microsurgery. Will clarify, and I will update with the comment next week. Thank you for watching. Bye bye. I will be in Almaty on 20th of March, maybe earlier, but let's see. 18th of March I'm in Chimkent. 19th of March I'm in Tashkent, and March 16 I'm in Semey city. Okay, tomorrow is the birthday of my daughter. That's why I should be with family in Astana. Thank you. Bye bye.